Hi, my name is Matt Egger. I'm one of the orthopedic surgeons with Sun Orthopedics of Evangelical, and my primary practice is with taking care of patients with spine problems, with neck and low back problems, but I also do a mixture of general orthopedics and trauma surgery as well. I want to talk today a little bit about my practice. When I first meet a patient that has either a back or a neck problem in the office, most times I'm working them up with x-rays, and sometimes they already have an MRI scan, but most of the time conservative treatment is common to start with. Things like anti-inflammatory medications, some other types of medicines at times, and also physical therapy are very common things for me to prescribe after getting a full story of what the complaint is, and also being able to evaluate a patient with a good exam and reviewing their studies that they may have already had done. So sometimes after I've been working with a patient for a while and simple conservative treatments aren't doing enough, there are times when further advanced imaging or sometimes other treatments may be required, more invasive treatments like injections or other interventions that may be needed before surgery is absolutely required. Sometimes patients can do very well with simple interventions, but other times there are times when surgery is definitely the best option, and we really try to exhaust all other treatment options that may be viable before considering surgery. Most of the time when someone has been working with me that is not getting better and we talk about surgery, we both come to a decision together to make a decision for committing to a surgery when the time is right. Most patients have lots of questions, and I usually take the time in the office at that visit especially to make sure that I answer all their questions to get a good understanding of what I expect out of the procedure, what they can expect before surgery, during their hospital stay, and especially with the recovery after surgery, so that there's a lot of questions that can be answered and put a patient's mind at ease before having to commit to such a major decision. Around the time of surgery, I would expect a patient to do very well with postoperatively being able to get out of bed pretty much the day of or the day after surgery, sometimes with the assistance of physical therapy. I would also expect that they are taking some pain medicine for pain control right after surgery, but can wean away from that medicine fairly quickly with a successful procedure. Our staff, both in the hospital and with my nursing staff in the office, are very familiar with evaluating patients and taking good care of them after surgery. If there are any concerns, I can always be available for further evaluation as well. I advise patients that work duties are usually not resumed for about a month to 6 weeks after surgery in most cases. People are able to get back to driving usually within 2 weeks or so after the first postoperative visit back to the office. We have multiple follow-ups that patients see myself or my physician assistants in the office while they're recovering from surgery, even up to a full year out from their surgery, in order to monitor their condition and make sure that things are going appropriately for them after a procedure. While there may be many different needs of different patients for specific kinds of surgeries, I really do try to tailor each surgical procedure that I perform to that patient's needs directly. Sometimes a minimally invasive surgery can be the best option, and sometimes more of a traditional open procedure is better, and I really strive to get the patient's problem fixed with the correct surgery the first time, the only time, so that's the only surgery they ever need. In my spine practice, I strive to combine both the expertise of what I do surgically with the compassionate care that I strive to provide each of my patients as I see them in the office, in the hospital for their day of surgery, after the surgery, to really put them at ease that they can know I really want the best for them, and I want to provide the absolute best care that we can at Evangelical with myself and all my staff for their care and their best experience possible.